I'm Terry Furman. The city of Lubbock providing an update tonight for us, confirming 167 new cases of COVID-19. Sadly, 7 new deaths. Now that's the most the city has ever reported in one day, and 128 more recoveries. We now have 12,107 recoveries, 1,912 active cases, and 146 total deaths. And as those COVID cases continue to surge in our area, local hospitals are working to serve patients in the Lubbock community and outside the county. KLBK's Olivia Whitehead joining us now. Olivia, we saw 7 deaths today. How are we looking with hospital capacity?
Well, there are now 160 patients being treated for COVID-19, which is the highest number we've seen and double what we were averaging last month. Now, hospitals such as UMC and Covenant are focused on expanding their resources as they continue to serve the Lubbock community and those outside of the county.
We always say that this virus doesn't have a zip code, and what we try to do is take care of the patients in our surrounding areas.
Helping hands in Lubbock as both UMC and Covenant continue to serve 40% of COVID patients from outside the county.
We have had to make some decisions as far as transfers of COVID patients. We are trying to keep a small number of our ICU beds in reserve just for COVID patients.
With 70 beds available, UMC says they are willing to move patients around to make things work.
We do have room for a lot more, and we can transition patients, even if they're COVID positive. They don't have to be in an ICU. They can be in a what we call a med-surg bed or on the floor. We have the ability to transition that quite a bit.
Covenant has also expanded their capacity, adding 90 new beds.
I mean, we adjust to the needs of the community, so we're constantly evaluating and have got plans to modify and change. But so what we'll see is, like last week, we had to go through the process of changing another unit and revamping another unit to be able to take care of the community.
They're remaining flexible.
Constantly in flex. How many ICU beds we even have are in flex. We have the ability to transform others into ICU beds or take some offline. Staffing is always probably the primary issue for any type of surge capacity. You can have the beds, but do you have the staff to man them?
Relying on their nurses to be able to handle a surge, especially as flu season rolls around.
You know, it really takes a team, and it's impacted everybody differently, but I'm just so proud of the way everyone's stepping up.
Now, we just found out that 5 of the 7 deaths today are from Heritage Oaks Nursing Home. Now, both of the hospitals expect an increase in capacity as flu season approaches, but they say they are ready to move patients around in order to manage the space. Terry?